We had Dr. Polsky with us today for an update.
Morning, gentlemen.
Good morning.
It's been a little bit since I've joined you, and so happy to provide an update today. I have not been much for making predictions over the course of the last 18 months, given all the unknowns, but I did say back in July that I was predicting an ugly September and October, and so far, unfortunately, that is panning out. So I will point out to everyone at home who's viewing that I was requested to have the slides in a week ago, so the numbers that are up on all the slides are as of last Tuesday. There's not a whole lot of change. I'll point out maybe one or two things that have shifted a little bit since then. But as you can see on the slide, that we had the highest number of cases last week ever, with the exception of that peak during the winter prior to the introduction of vaccinations, or at the point where only first responders and healthcare workers were able to access vaccines. So it's a little bit easier to see the numbers there, and you can see, although we had what seems like a little bit of a dip the week of September 2nd, there's a little bit of artifact in there because that was Labor Day week, and almost certainly, and you can see by the numbers of the number of people being tested, that's a reflection of fewer people getting tested during the holiday week, and not that there was an actual decrease in virus transmission. Sorry, this button's a little... and you can see by age group, so concerning, especially with the start of the school year, is that the positivity rates, or the number of cases for both elementary and middle school, which would be that first series of rectangles, and then high school, both of those went up appreciably, keeping in mind that the second set of bars of 15 to 19-year-olds, there are 3 times fewer individuals in there than in that other. So keep in mind the scale is going to be a little bit different for those two. The only bit of good news is we still continue to see very low numbers of infections in people 75 and over, but we have seen a bit of an increase in cases in the 66 to 75-year-old age range. So taking a look a little bit back in time, I think this is important to get a little bit of perspective. So looking back from the early part of August up until last week, there was a little bit more than a doubling of hospitalizations across the state, and also more than a doubling of intensive care unit admissions. Deaths tripled from the early part of August to the middle of September, and that's one of those areas that we've seen a further increase. So on that slide, it shows 105 deaths across the state for the previous week. The week that just concluded, up to 133 deaths. And while I'm trying to get this to advance, I will also mention that hospitals are filling up. And so both Anne Arundel Medical Center, I may need a new battery in this, both Anne Arundel Medical Center and the largest hospital in the Eastern Shore several weeks ago suspended all non-emergency surgeries because they have so few beds in their hospitals that they're unable to accommodate anyone who should need inpatient care after surgeries. Yes. Sure. And there was a situation the previous weekend here where our hospital was unable to transfer someone out for advanced ICU care because there was no hospital in the region that could accept the transfer.
Dr. Polsky, in reference to the hospitals being at capacity, is that the beds at capacity, or is that the staffing that's at capacity?
Those are always linked. So you certainly need a physical space, but then you also need the staff. I can't comment for hospitals outside of our county as to which of the two or whether both were an issue, but that does bring up a good point that, number one, after 18 months, you're seeing more and more burnout, and we know that, at least in some cases, nurses and doctors who would have possibly retired somewhere down the road are taking retirement at an earlier time because they're just completely exhausted. The other is that when you see the numbers that we've all been seeing in the southern part of the country and out in the Mountain West, that those hospitals are absolutely desperate. And so they're paying ridiculous amounts of money for nurses to come and work in these temporary assignments, which means that they're pulling nurses away from other regions of the country. And so this is not a workforce that just has unlimited bounds. That whenever you're working with licensed professionals, you just can't create them out of thin air. And if you're going to pull them in one direction, that means you're pulling them away from another direction. So as we take a look at vaccination, I just want to re-emphasize how well vaccines work. I'm going to talk about boosters in a little bit, but I don't want that to in any way shake people's faith on how well vaccines are working. So again, at the time that I put this together, 83 out of 84 residents in Calvert who have died from COVID were unvaccinated. And keeping in mind that our vaccination rate for seniors is well over 90%. So if people were not vaccinated, the number of deaths we would have seen at this point would be well into the hundreds, and possibly, not being no hyperbole, but we may be over 1,000 deaths at this point if it wasn't for vaccinations.
So, Doc, I spoke with a doctor talking about vaccines. And maybe this information is widely known out there, but I had not run across it. I said, when I'm talking to mom and dad say, well, it's not okay for my 11-year-old, but it's okay for my 12-year-old. What's the difference? And I don't have an explanation. I'm not a medical professional, but I don't. But talking to a doctor this past week said that the problem is that the amount of dosage is the same given to a 12-year-old as to a 25 or what have you, and that what's being worked on it's still the same type medicine but a lower dosage, and they likened it to like you would give your child children's Tylenol to your thing. Is that accurate?
So I have to preface it by saying that the data for the 5 to 11-year-olds where they have used different doses has not been released publicly, so I have not seen any of that information. So I cannot comment as far as at any lower doses, how that is working relative to what was the standard dose for adolescents and adults. Certainly in some respects, you mentioned things like Tylenol, where an adult dose would be toxic to a child's liver,
Right.
so there's good reason. Part of the factor for vaccines is that the younger you are, the better you respond. So it's not so much that a higher dose would be toxic, it's more the fact that a lower dose is likely to give just as vigorous a response in a child as a larger dose would be in an adult. So we never want to give more of anything than we need to. And so what they were looking at in the trials is what is the optimal dose in children so that they don't end up giving more than necessary, even if there really wasn't a toxicity component.
Okay.
And that age 11, age 12, there has to be a line drawn somewhere. And so that cutoff point is typically when we start to see adolescent changes. And so in some cases, because of hormonal changes and other accelerations in growth, that what would be adequate in that age range above that 11, 12 cutoff may differ from that 5 to 11. They could have at some point drawn it at 10/11 or 12/13. So there's a slight bit of, you have to make a cutoff somewhere. But so to answer your question, 11-year-old versus 12-year-old, in most cases, not a dramatic difference.
Doctor, real quick, on that 83 out of 84 Calvert residents, how many of those were before vaccines were widely available?
I will have to get back to you with a specific number. So you also have to keep in mind that there's been a rolling. It's not like everybody got vaccinated on the same date.
Understood.
And so I can look back. Off the top of my head, I would say roughly just a general sense that it was probably about a 50-50 split from when vaccines became available to the general public, not just first responders and healthcare workers, but when it was available more widely.
Thank you.
And what we've certainly seen over the last, especially since Delta has shown up in July, is that the deaths are skewing younger and younger. So of the 5 deaths that we had in Calvert a week ago, we had 3 people who were in their mid-50s or younger. And so although we did occasionally see people in their 40s, 50s, and sometimes even younger going back, with Delta, we're seeing that even a little bit more frequent. And then just to, again, to get back to Commissioner Gadway's point, that everyone who ends up getting hospitalized, even if they don't die from the illness, that those are hospital beds and those are resources that are now being diverted that cannot be used for people who have heart attacks, for people who are undergoing cancer treatment, for people who very much need surgery. So we have to think broadly that this is not always just about us, but what happens to us impacts all of our neighbors and our family members. If somebody somewhere can advance that slide, and bring me maybe a fresh battery. Thank you. And so I just wanted to talk for a minute, since we're now into the school year, about COVID consequences for children and adolescents. I know that early on there was talk about how COVID wasn't such a big deal in children. So with the original strain of COVID, what we were seeing was that children were about 50% less likely to become infected. There was never a time where children were just immune from COVID, but there was lower incidence. With the Delta variant, we're seeing no differences in transmission among children, adolescents, or adults. And what we have seen nationwide, and also right here in the state of Maryland, is about 1 in 100 children who are diagnosed with COVID end up with disease severe enough that they need to be hospitalized. About a third of those children need ICU care. And the majority, since roughly 99 out of 100 will not get hospitalized, there are other health concerns. So asthma exacerbations, this is an illness that oftentimes the most obvious feature is cough. That children with underlying asthma, this can trigger weeks or even months of prolonged cough. And prior to COVID, the number one cause for absence from school was asthma exacerbations. So we can't ignore that even relatively mild COVID infections in children with asthma can lead to really significant problems. Also, studies have taken a look at what are being referred to as long-haul symptoms. And the studies have varied a little bit. I've seen estimates over 10% of children and adolescents with long-haul. I've seen some as low as 2%. The best study I've seen showed 4.4%. So roughly about 1 out of every 20, 25 children will develop symptoms that will drag on for weeks or months. And the most common features are fatigue, difficulty concentrating, and foggy thinking. And when we think about education for our children, all of those factors are going to make it much, much more difficult for them. So if someone can advance the slide.
Sir?
Yeah.
I'm sorry, doctor. In reference to kids, I was really surprised, and I don't want to get off topic, but pneumonia takes more than double the amount of children across the country than COVID has over the last couple of years. What can we do about stopping pneumonia as well amongst children?
I'm not sure about those statistics.
It's 956 versus 429.
Okay. Well, I'm not sure how much time we want to spend on other topics, but
Right.
happy to address. So pneumonia can be caused by a wide variety of both bacteria and viruses.
Okay.
There are pneumonia vaccines. There are multiple typical pediatric vaccines that deal with preventing respiratory illness. So first off is make sure that your children are vaccinated against everything that is recommended by the CDC and almost certainly recommended by their pediatrician as well.
Mm-hmm.
And then controlling underlying conditions. So I don't know for the figure you mentioned, I don't know what percentage of children have underlying conditions like cystic fibrosis, other conditions that can very much predispose. So the second is making sure that for any children who have chronic underlying conditions, that there's regular follow-up to make sure those long-term conditions are managed. Okay.
Thank you.
All right, you're welcome. Again, statistics as of last week, looking at both cases of COVID among students and among quarantines. So for technical purposes, the state and the CDC have defined the word isolation, meaning a child or a staff member who actually has COVID, they need to be isolated from everyone else. And then someone who was a close contact and potentially could become contagious, they become quarantined. And so for isolation for students actually having cases of COVID, you can see 126 as of last week, and that's cumulative. I'm sorry, too many numbers. So 31 cases, that was for that week. And then 126 exclusions or quarantines, so children who were close contacts and needed to be isolated. When you add that up, it constitutes about 1% of the student body across the county. So 99% of students, despite all that's going on with COVID, were able to consistently attend school. And that's pretty much been week to week that we've seen about 1% of students excluded either because they are infected or because they've been a close contact. The vast majority of those cases we are not tracing to a contact in the school. Oftentimes it's household transmission, thank you, or other sources. But we have seen some transmission within schools. So the most current data that we have shows that, and I have 1 in 7 close contacts have tested positive for COVID, so it was about a week ago. The most current is 1 in 10. So our positivity rate for students who have been close contacts in the school and then get tested is about 1 in 10 have actually contracted COVID. Now, I will throw out there that only about 35% of parents have had their children tested if they've been close contacts. So it's limited data. I cannot say that 1 in 10 of all of the exposed children, but of those that have been tested, again, we're picking up about 10% positivity rate.
So what's the current policy? I think you know this. The current policy at the Board of Education for child test positive. What's the proximity criteria for telling a child they have to stay home?
It's within, assuming that there is universal mask wearing, and that's important. So if everyone in the classroom is wearing masks, then anyone within 3 feet of an infected person then needs to quarantine. And that's a statewide, that's not a county-specific criteria.
And then what's the process for that child to come back to school that has not tested positive?
Yes. So if the child stays without symptoms, if a child becomes symptomatic at any point, then they get tested right away. If they remain without symptoms, then they or their parents have the option of having them tested somewhere between day 5 and 7 after the contact. And it has to be a PCR test. If the PCR comes back negative, no infection, and they remain asymptomatic, then they can return 3 days earlier. They can return on day 8 as opposed to returning on day 11 if they are not tested.
And that's if they have no symptoms?
Correct. Certainly if they're symptomatic. Well, first off, and it's a general school rule even way before COVID. If a child is clearly ill, they're not coming into school. And the typical rule, if it's non-COVID, is no fevers for a full 24 hours, and if their symptoms are resolved, then they can go back to class.
But no symptoms, it's 8 days. That's state law. It's 8 days.
Well, so these are not laws. These are state policies formulated by the Maryland Department of Health and the Maryland State Department of Education. But that is the standard across the state, and those are also the standards through the CDC.
I don't know if you probably don't know the answer to this question, but are these kids available to do the virtual learning from home while they're being quarantined?
Yeah, so I know that the school system is going through some adjustment the first week or two, figuring out how to make sure that children who were excluded had access. To the best of my understanding at this point,
Right.
Any child excluded due to COVID exposure, whether it happened in the school or whether it happened outside of the school, then they're able to do virtual learning.
Yeah, because a kid could get exposed, go through that period, come back, and a week later be exposed to another student again.
That's a possibility.
And it could just be, continue.
Right. So, and I will just point out that for those who are eligible for vaccination, if any vaccinated student is not subject to quarantine. So everyone in the high school and so about 2/3 of middle school students, if those students were vaccinated, the numbers for exclusions would be 0.
So if they're vaccinated, they don't have to, even if they're exposed, they don't have to be quarantined?
As long as they do not develop any symptoms. So we know there is some potential for breakthrough. But again, extrapolating from other types of vaccines, we know that for children and adolescents that they mount a much stronger immunity. So the likelihood of a breakthrough case in a child, or in this case, adolescent, because it's not the vaccines aren't approved for children yet. But in adolescents, the potential for breakthrough cases is going to be substantially lower. I can't give an exact percentage, but it's going to be lower than it would be for adults.
But I thought if you were vaccinated, you could still get it.
You can. So again, adolescents respond much better to vaccines
Right.
than adults. So it's not a zero risk, but it's substantially lower. So the determination has been made that because the risk is so low in fully vaccinated, and to be fully vaccinated adolescents, that they can remain in school as long as they are asymptomatic.
And just make sure I got it clear. So if a child is not vaccinated, they've been exposed, they go home, they get tested, they don't have it, no symptoms, they're 8 days. If a child is vaccinated and they've been exposed, they're not excluded at all.
Correct.
Without any kind of testing.
Correct.
I don't understand.
But yet CDC says that both vaccinated and unvaccinated people, regardless of age, can carry and spread the disease.
So I'll state again that no vaccine is 100% protective. That in adolescents, protection with any vaccine is stronger protection than we see in adults.
But the vaccinated person could still carry it and still transmit it.
This
correct?
is always a probability event. Anyone in the school, anyone could potentially be carrying COVID. So what they are trying to balance is what is the risk of that individual compared to the average person in the school, and is that risk high enough to warrant that person needs to be excluded from the school?
And that's a school policy or a state policy?
That is a state policy, that is CDC policy, and to the best of my knowledge, every school district in the state of Maryland abides by that policy.
So did you say earlier of the students that have been quarantined from exposure, how many of those have developed COVID?
So of the ones who have been excluded, only a third, 35% of parents have had them tested. There's no way for us to know once a student is home whether they have developed COVID. If a child starts developing a cough 3 days later and the parent chooses not to get them tested, we have no way of knowing that.
Of the
So
35% that are tested, how many of
So
those children
10
have contracted?
So 10% of them, so it's 208 to be specific, 208 children have been tested, 20 of them have developed COVID.
And
Go ahead.
All I was going to say was the oversight piece is probably, the challenge, right?
Just a bit.
Okay.
Yes.
According to the state website, Maryland State COVID Resource website, the only cases of COVID in Calvert County are at Plum Point Elementary, and that's at 13 cases. How can we work better on getting the data properly?
I'm sorry, I'm not sure what source you're looking at.
The state of Maryland COVID resource graphs, everything else,
Okay.
where you go on and click schools on the Maryland State
All right.
website.
So I have no control, and I will say that for all the good work that is being done at the state level, looking at county-specific data, regardless, maybe with very, very few exceptions, is not reliable.
So whose data is not reliable, the counties or the states?
What is typically put on the state site is not going to typically be a reliable source of data. So our health department website has information there. Parents can check. Starting probably tomorrow, there will be school specific. So what we have had up since the beginning of school year is by region of the county, and we've done this all the way through. So southern region of the county, central region of the county, and northern region of the county. And then we also break it down by school level. So there's a graph for elementary, there's a graph for middle schools, and there's a graph for high schools. Starting, again, likely tomorrow, there will be a school-by-school breakdown of the number of cases in the past week and the cumulative number of cases since the beginning of the school year. So I would advise not going to any state source for that. We're going to have much better data locally. Having inaccurate or inconsistent data is tough to swallow.
for example, because according to the state site in Johns Hopkins, Calvert County has had 5,117 total cases of COVID since all this started 561 days ago. But yet your site shows almost over a 50% increase in that at 8,290 cases.
So there are methodological challenges, I'll put it that way. The state only defines a case if there is a PCR confirmation. That's not how things work in the real world. So if any one of us here is symptomatic and we go to our doctor or urgent care, there's a very good chance they're going to do a rapid. And if the rapid is positive and somebody's symptomatic, there is about a 99% chance that that person has COVID. They don't do a PCR, so the state does not count that person. The state undercounts not only in Calvert County, but they undercount all across the state. I talked to my colleagues and have been talking to my colleagues all the way through this. There's a general frustration, but that is the way that the state counts things.
So
again,
one thing that I recall that we learned at the beginning is if somebody was in the Calvert Hospital and had COVID, but they lived in St. Mary's County, that counted as St. Mary's County, right?
They count by county of residence.
Right.
And with deaths, that is particularly problematic because it's not even where that person lives, it's what the family puts on the death certificate.
Right.
And we've had multiple cases where people have lived in nursing homes outside of our county for years,
Yes.
and the family puts a Calvert address on, and so
Right.
the state counts that as a Calvert death, even though the person contracted COVID outside of our county,
Right.
went to a hospital outside of our county, and died outside
Which
of our
creates inaccurate information also.
Right. And
Right.
again, for all of these things, myself and many of my colleagues have voiced our concerns about the interpretation of the information out there by the general public and how that can sometimes be misleading. But ultimately, I have no control over how the state presents its data.
Well, somebody's
Doc-
got to send them the data. That's all I was wondering.
And Doc, I'm not attacking you. So to talk to mom and dad, and that's really the most important people in this when because our kids. This is why you get out of bed. I mean, if you got children and they're not your top priority, there's a problem. It seems like there's a huge disconnect because, and I'm not saying you. I'm just saying it seems like the system has absolutes. Get the vaccine, right? Absolute, get the vaccine. But then like the discussion we just had about between 11 and 12, to get the vaccine, but you can still transmit it, but you don't have to go home. But don't trust data on this side. You know what I mean? There's all this, trust me, but don't trust them. I think that at the end of the day, all they're looking for, just hit me with the truth as they know it today. Just give me the best available information. But if you say don't trust that site, boy, that's pretty upsetting. I mean, that's pretty disturbing. What does mom and dad do? Who do they trust?
Commissioner Hart, again, and you can go back through this whole 18 months. I defy anyone to find anything that we have talked about or our health department has provided that has not been the best available information. I have no control over what happens outside of my agency, but if people want the best information for what's happening in Calvert County, then our health department is the best place to find it.
Dr. Polsky, a few weeks ago, I called your department, your office, and I said, hey, I need to find out where I can find the J&J vaccine. And your department, the lady there was very polite, very nice. She was very apologetic even. And the fact that, sorry, sir, we don't keep that data. We don't have access to that data. And I said, okay, well, out of all the billions of dollars that have been put into this, if somebody wants to get a J&J, how do they go about doing that? And your department had the exact same response as the state, so I'll give kudos there. You guys and them were in direct alignment. They said, hop online, Google pharmacies near me, and just start making phone calls and ask them if they got the J&J. That was the solution that I had to go back to the person that was asking the question with. That neither the county nor the state had any records or data on where vaccines were available, specific vaccines were available. Which was, that was pretty disheartening. It was disappointing and disheartening.
So Johnson & Johnson vaccine manufacturing completely halted in late spring or early summer. Neither we nor any state agency across Maryland has had any Johnson & Johnson until this week. We got our first small shipment in. anyone who may have still had Johnson & Johnson, it had been sitting on their shelves for months, and there is no state database. I'm not trying to make excuses. We have very limited staff. For us to be able to run down every question is just not realistic. That means that we are taking time away from other things that need to be done. I personally, I will say I don't think it's unreasonable for someone to call a couple different pharmacies. But you all, it's important for everyone to keep in mind that public health has been neglected for decades, that we don't have enough staff to do our normal non-COVID on any given week. We have people that have been doing truly yeoman's work for over 18 months now. And every time that we take on a new responsibility, that means that we have to stop doing something else that is assisting other residents of our county. So as much as I'm sorry that you couldn't get your answer.
Well, I did. It took me 17 hours of phone calls over the course of 3 days, but I found it.
But
So,
there's a reason why there's a limit to how much we can track down for everyone who calls with given problems. At the moment, Johnson & Johnson is available again, but again, we have a limited number of doses. So for people who are interested, they can, if they go on our registration on our website, if they scroll down for the vaccination clinics, they can see where Johnson & Johnson is, and they are welcome to register for a dose. And then hopefully we will continue to get replenished supplies, but again, we have no control over the supply chain.
So, Doctor, recurring theme, and obviously this entire country is having a staffing issue with everything, from a truck driver to a doctor. That's a recurring theme. But there are priorities. So, obviously, health's got to rank, right? Has the state made any provisions, whether about bringing in military doctors or military staffing? I mean, obviously, we can't be the only one with this problem. All 24 jurisdictions must have this. I mean, is there any discussion of trying to get labor from somewhere?
The help just really isn't there. And again, as we talked about earlier, when there's crisis mode, in Tennessee and Louisiana and Florida and Texas, that any and every available, they're going to be pulling over there. That you can't just manufacture new doctors in Maryland overnight.
No, but does our military have those type of resources? I'm a small business guy, right? So
Yeah.
to run my business, no matter what I got to do, I will kick every tire, everything outside the box. So just the question is, I'm sure this is a universal state problem because it's a country problem.
Commissioner Hart, I don't know the answer. I don't know whether the military has, I won't say excess doctors and nurses, but have sufficient to be able to both take care of the military personnel that they have a responsibility for and provide relief or assistance across 50 states in the country. My guess is that that's probably not realistic. But those are questions that I can't answer because I don't have direct contact with people that can make those kind of decisions.
about a year ago, a little over a year ago, I remember National Guard came to the rescue across the entire country, setting up different locations and everything else. And that was done by simply asking. And the National Guard got mobilized and they showed up with doctors and nurses and everybody else. But hoping you're in communication with those around in Calvert County, do you work directly with the hospital and the CEO and the president of the hospital and working, trying to come to resolutions on some of this stuff?
Yes, we're in contact on a very regular basis, multiple times a week.
So when was your last conversation with the president or CEO of the hospital?
So I talked to the chief of nursing yesterday about staffing. We realized that there are a host of issues, that both staffing for testing, staffing for vaccination, staffing for host. So yesterday was the last time. Do I talk directly to Dean Teague every time that we have a staffing issue? No. Oftentimes there are other people in hospital leadership. I talked to the chief of the ER yesterday. So if you're asking, are there continuing discussions between health department and hospital? Yes. And oftentimes those most productive conversations are happening with the people that are most directly overseeing the types of resources that are in question.
Right, but as the senior health officer for this county, you said you don't communicate with Dean.
I didn't say that.
Or
I just said
regularly?
that my
Or-
conversations yesterday
Right.
were with the director of nursing and with the chief of the emergency room. And so it's my job to talk to the people who most directly understand the situations we're dealing with and potentially can get the resources to solve the problems.
I'm trying to wrap my head around that because in a wartime environment, the generals talks to the generals, the presidents talk to the presidents. You as the senior person, when was the last conversation you've had with the leader of the hospital?
I can't give you an exact date. And I will say that I don't like military analogies for healthcare.
Would it be safe to say it's been over a year since you spoke to him?
No.
Okay.
In any event, I know we got more slides to roll through and you have an agenda.
So what is the staffing shortage at the hospital?
You need to talk to the hospital directly. What we were talking about was providing for outpatient testing. As far as specifics on different units, again, that's a Calvert Health Medical System question.
Is there a mandate for vaccinations at Calvert Health?
To the best of my understanding at the moment, there is a test out option.
Thank you.
All right, so just quickly to move on. So for pediatric hospitals, this is, you may recall from a little while back going forward, not backwards. Just as we get back to the consequences of COVID infections. So as of, again, about a week ago, there were 130 children who had been hospitalized in Maryland since the beginning of August. And the reason I chose this interval is that this is really the start of the Delta wave. And on the slide, it says there's one child from Calvert that required hospitalization due to illness. It's now two. Another child this past week had to be hospitalized.
So Dr. Polsky, based on the discussion that just happened, I'm not sure we have much confidence in any state data that you're going to present, and we should focus on Calvert because we know, you say you know what those numbers are, correct?
Correct.
That would be good moving forward.
Fair enough. All right. So vaccination rates, again, as of a week ago, 60% of high school students and of the eligible middle school students, 52.7 over this past week. Some more students have been vaccinated, so we've just crossed the 60% threshold for high school. And then where we rank statewide, so this is relatively unchanged, really over the past several months. And these are numbers, if you can look week by week how many Calvert residents have been vaccinated. And the last 2 weeks that are not on the chart, or last week that's not on the chart, additional 479 this past week. Here's all the big charts with the big numbers. I'm going to just pop through those. And then I did want to mention about booster doses. So the state refers to third doses, which the CDC defines as for people who are severely immunocompromised. They distinguish that from booster doses, which is for the rest of the population, or essentially 98% of the population who are not severely immunocompromised. The state has fused those all together as additional doses. Just wanted to point out that to this point, Calvert has the highest percentage of people receiving that additional dose relative to the other 23 jurisdictions. And so our protocol, yeah, I'm sorry, Commissioner.
Just to confirm what I thought I heard on TV, it's not a good source. Boosters are only for Pfizer.
So the FDA has approved Pfizer doses, Pfizer for boosters at this point. They are currently, I think, in the process of reviewing Moderna. I'm pretty sure Moderna submitted their,
But as of today,
correct.
You can only get a booster if you had a Pfizer vaccination.
As of this moment, the FDA has only approved Pfizer for booster doses.
Now you're turning into a lawyer on me.
I am giving the most precise wording I can.
Bottom line is you can only get a booster today if you had a Pfizer vaccine.
So our booster protocol is in most ways in keeping with the CDC recommendations. But there are some slight variations, and this was developed and during a collaborative discussion with physicians representing all of the practices in Calvert County. We reviewed the data that we have seen locally, which is much more detailed than what is available nationally. And so what we've seen by reviewing the local data is that over a third of the hospitalizations that have happened as far as breakthrough cases since August 1st, since Delta became a problem, have happened between 4 and 5 months after the second dose received. And so the consensus among the doctors in the various practices was that waiting until 6 months left actually, and then you add in the people who end up hospitalized between month 4 and 5 and between 5 and 6, would have left over half of the people who ended up hospitalized still vulnerable to infection. The Israeli government set their threshold at 5 months. And so for the moment, what we have locally is that anyone who's at least 4 months since their second dose and is 50 and older is eligible for a booster dose. And that's if they've received either Pfizer or Moderna.
So who approved Moderna boosters?
This is happening, and I would just say that there are practical considerations, and the practical considerations are that these doses have been given out really across the country. The CDC even acknowledged that as they were deliberating, more than 2 million Americans have received booster doses. And so at this point, we have seen both Moderna and Pfizer completely mirroring each other in terms of both effectiveness and safety. Everything from the initial trials back in July of 2020 to their introduction to the general public in December. They've been indistinguishable in almost every respect. And so there is absolutely no reason to think that the data that was submitted by Moderna will show anything different than what was seen by Pfizer. The practical question is, for the 100 million people who receive Moderna, do we leave them vulnerable to infections that could kill them? And certainly we've seen that people who are, at least locally what our data has shown, that people who have had breakthrough infections, there is no difference between Pfizer and Moderna.
So why hadn't CDC or FDA said go ahead and give Moderna?
All right. So the FDA and Commissioner Hintz, I'm sure you're aware that the FDA has strict federal protocols.
How about the CDC?
And the CDC, that is an interesting question, and I can't speak for the CDC. So
that's why people are so confused and have issues trusting the data.
Well, it's not trusting the data. This is a different issue. So the CDC did go ahead and move forward with third doses with a very limited amount of data. And again, the third doses are people who are severely immunocompromised. They took a different tact with booster doses. So that was, as far as I can tell, a judgment call on the CDC's part.
You know, Doc, what's sad is any of us old enough to remember the AIDS debacle. We're no better today, it seems like, than we were back in the 80s. When we weren't testing the blood supply. It was misinformation how you get it. You know, it was all this money put in it. It seemed like we learned nothing as a country, because if you can't trust a state website, I mean, to say even the data is wrong, I get it that things evolve and things change and adapt and all, but if we still can't trust the information on that site, is a really sad state of affairs as a country. When we were faced with that in our time, it's not like, you know, people go back to Spanish flu or polio. Some of us, you know, aren't old enough to remember polio. There's still some folks do, but none of us remember that. You would think that we would have gotten better in delivering a message with the billions of dollars and the millions of promises and all the professionals and all the education in the world that we should be able to put on there for mom and dad, information that they could trust. I mean, I think that's what I'm walking out of here pretty sad with. And you remember the AIDS debacle. I mean, that was a tragedy. What the information that came out of government, and so that's sad.
Commissioner Hart, I will just emphasize that as a physician, with my primary responsibility to the health and safety of the people who work and live in Calvert County, that I am providing the best data possible for our county.
But you would say don't trust that site, correct? Only trust your site.
I'm saying
accurate?
that So I think there are two issues. One is for specific data points, who has the most accurate data? And the answer to that is that locally we have the most accurate data. The second is, and this is a more fundamental question, is can people trust the public agencies that serve them? And I would say that regardless of whether it's the CDC or the FDA or our local health department, that all of us are doing the absolute best job that we can under the circumstances that we are working. These are truly unprecedented circumstances that we're dealing with. The FDA has strict protocols that they have to follow. They can't approve things unless they go through a regulatory process.
Which I
There's
agree with that.
long history of physicians using medications off-label once they are approved. That happens on a
I like things
daily
tested.
basis.
I'm a big fan
And,
of.
and so
I like to know it works.
as a physician, I felt it was my responsibility to talk to my physician colleagues around the county. If they had felt that the best course of action was to wait for the CDC and follow them in lockstep, then that's what we would have done at our health department. But there was complete consensus across all of the practices that given the evidence that we had an ethical obligation to make these vaccines, these booster vaccines, available to the residents of Calvert County. That by not moving forward, we were leaving people's health and sometimes their lives in jeopardy unnecessarily. So
Are
I
you going
cannot
against
comment.
CDC regulations?
I cannot comment as to the distrust that has been fomented in this country over decades now, but I can say unequivocally that the residents of Calvert County can trust our health department to provide the best advice, and that they should also consult with their personal physician or nurse practitioner to decide what is best for them.
But are you following the CDC guidelines by doing that?
I will say that we are following about 95% of what has been laid out by the CDC, and there are a few things that are slightly different. So
But
the
see, Doc,
CDC...
that gets difficult on that sticking point, and I'm not a doctor, but I will say I'm a big guy of the law is the law. And so if we're going to enforce something over here, you can't not enforce something over there.
These are not laws. So
But we use that as a basis with everything, right? We say the CDC says this, the CDC says that. So if we're going to trust them for that, do you know what I mean? You see the disconnect. So if you say, and if I understand you right, well, the CDC says Pfizer, not Moderna, but then we locally say no, it's okay, use Moderna. Then that means then all the information come from the CDC. We don't listen to. No?
that's a misinterpretation of what we're achieving.
And that's what I'm asking.
So the majority of people in Calvert got Moderna because of just the luck of the draw. What was sent to Calvert County was predominantly Moderna.
And they may come back tomorrow and say it's okay, but when you start interpreting...
And Moderna is a newer company. I don't know exactly why they've trailed a little bit, but the reality is that almost every step of the process, Pfizer has been a few weeks to a month ahead of Moderna. I can certainly see the most plausible explanation is that Pfizer has dealt with the FDA for decades. They know every step, they can anticipate everything. So it makes sense that Pfizer has always been a few weeks ahead. At this point, again, we have seen a year and a half, over a year, of completely mirroring efficacy and safety between Moderna and Pfizer. There is no logical reason to think that the Moderna booster will be any less effective or any less safe than was for Pfizer. Of the majority of Calvert County residents who have been vaccinated, they have received Moderna, not by choice, but that was what was available. To hold them back and leave them in jeopardy, and if you think back to the slides I showed early, with the prevalence of virus in this case, that we, and this was when I say we, collectively as physicians in this county, felt that we were leaving people in true harm. And our option was to do what physicians do on a regular basis every day in this country, which is in some cases use certain medications off-label. It should be done carefully and wisely. This was not just some spur-of-the-moment random decision. We reviewed, and I listened to the FDA's the CDC's discussion that dragged out for hour after hour. The evidence that they reviewed, we reviewed as well. Plus, we had more detailed hospitalization data than they were able to consider. And as a result of a collective decision, and there were no outliers, everyone on that discussion agreed to the protocol that you see up there.
So is the other jurisdictions in the state following the same thing?
This was a Calvert decision, what we felt best. And so the other thing to keep in mind is that there is no compulsion with this. What we are doing is we are extending protection at the option of individuals. Anyone who wants to wait for the FDA to act on Moderna's application and the CDC to come out with recommendations is perfectly able to do that. No one is telling someone that they have to get a Moderna booster. But we know, again, that there are practical consequences of withholding vaccines at this point for people who have gotten their first two. And any preventable hospitalization, any preventable death, that's my job, and certainly my colleagues around the county felt that that was their job as well.
Doctor, months ago, everything was about testing. You made the comment a second ago about it's been a year since the vaccines. I think the vaccines have only been since December of last year, so 8, 9, 10 months. But why is it so hard to get tests in Calvert County? Calvert County is the last 24th out of 24th in the state on testing our citizens.
So this has never been all about testing. In Calvert County, this has all been about behavior and making sure that people aren't unnecessarily exposing their neighbors, their classmates, people in their community and religious congregations to the spread of virus. This is not about testing.
But yet,
Commissioner Gadway, if you can give me a moment,
okay,
please. This is completely about how we treat each other and the respect that we have for each other. So Calvert County, according to the state data, which, again, take it for what it's worth,
can't trust,
has consistently shown that we are last in the county. Calvert County has the lowest per capita death rate and the lowest per capita hospitalization rate. Those are the two numbers that I care about. It's not how many tests that are done. It's how many people are getting sick and how many people are dying.
But if we could put testing into elderly and parents' homes that have students for rapid tests before they leave to school in the morning or something like that, or leave to go to the grocery store, and be able to catch it early, from everything I've been told, if you catch it early, there's much more and better treatments available to you to limit the life-threatening complications from it.
So this is an extraordinarily complex decision that this is not the proper forum to talk about how you optimize testing with any county, because it touches on a whole host of things. Number one, how many tests are actually available? Number two, who is going to interpret, who's going to record, who's going to contact trace, and then you get into further issues beyond that. So certainly we can have discussions later on, but the subject matter that you're broaching is not a two-sentence answer that is reasonably covered in a setting like this.
Can you answer in 2 sentences why Calvert citizens have to leave the state to go to Fairfax to get a test so they can fly?
I'm not aware of anyone leaving the state to get a test, so I can't answer a question that I'm not sure what the basis of that
Well,
question is.
I know that some of the letters that you've sent out telling parents that they have to get tests in order to have their kids come back to school, when they call up to make appointments, the earliest they can find an appointment for a test is sometimes 5, 6, 7 days to try and find a test.
The health department has a testing site on 231, and you don't need an appointment, and you can just show up between 8:30 and 12:30 for ending quarantine for the asymptomatic children who want to get back to school on day 8 instead of day 11, and that information goes out to parents when they are notified that their child has to go into quarantine.
Docs, and I'm not going to beat you to death on this, this CDC and everything else like this, but if somebody does get a booster and it's not FDA approved and something goes south, do their insurance companies back that? I mean, is there any talk to with the parent, with the patient to just, that to make sure that they're okay through this if something does go wrong?
I will get back to medications used off-label every day. I'm sure I can't be certain for you as an individual, but for most people who are listening to this, at one point or another, they were prescribed a medication that is not FDA indicated for that specific condition. Every medication that is used to halt preterm labor is used off-label. There is not a single medication that is used in the U.S. that actually was FDA approved for preterm labor. And you can go across the board for how medications are approved for one purpose and routinely used for others, because that's the most practical way to take the best care of your patients.
And the only reason I ask is when I was a kid, Dr. V, if he didn't have it in the back room, you didn't have it. Okay? I mean, it was really that basic, but we're in such a litigious society today, and things are so traumatized. I mean, we had a discussion earlier, about medical expenses and bills and stuff, and sometimes that's a complete financial devastation for folks. So I didn't know if there was a discussion out there that if the patient came in, that they were made well aware of, hey, this is not approved, and this is potential consequences, or there's none consequences. That's all. I was just inquiring.
I'll just remind the board it's 11:06.
Oh,
Yep.
Excuse me, Mr. President.
No, just
Oh, we can.
I'm
not do
available all
the-
day.
a friendly reminder.
Dr. Polsky. I received a letter from a parent that was signed by you that because their child was in a room with another child that tested positive, their children have to quarantine, and it was on state letterhead, really official, and it said to the parents that they must not go to work until the parents are evaluated. Where's the legal authority on that, sir? I mean, a person who you have no idea who it is, you've never examined them, you have no idea what their job entails, but yet you're telling them that they must not, was the words, must not go to work.
So given that I don't know which specific case you're talking about, it's
Huntingtown
a little
High
bit hard.
School letter.
Well, so we have 16,000 students in the county, and of which there are, I don't know, 1,500 in Huntingtown. So I'm not sure the specific circumstances you're talking about. I will say that we do contact tracing, and if we know through contact tracing, that means that a nurse is reaching out and contacting the family and going through questionnaires, that if parents were close contacts, that still under MDH guidance, that those parents are supposed to quarantine, just like students are.
Supposed to, not must. I mean, the letter said must not go to work. If the person has a job outside on a sunny day and he's able to go to work without interacting with any other people and he feels fine,
So I
why can't he
don't
go to
know the
work?
circumstances of this particular letter. It's possible that parent may work in settings such as a nursing home or other such settings. So I
Sir, he
cannot
works
comment.
outside painting windows.
Again, I hear what you're driving at. Just
Okay.
to bring up a letter that I don't have the opportunity to do any background on. I don't know what else to say at the moment.
Your name was at the bottom and signed it. That's why I thought it was from you. Have you given instructions to having windows down on school buses?
I'm sorry.
Have you given instruction or suggestion to have windows down on school buses while kids are being transported?
We had discussions all through the spring and summer that to optimize airflow, that on days where the weather was conducive, to crack the windows about an inch or so that we would minimize the buildup of aerosol. Yes.
All right. If you could reach out to the busing people or whatever, because last week I received calls and video of children having water sheeting through the windows,
When
crying.
the weather is conducive,
Obviously, your message did not get across clearly. It may have went through a state website, I don't know. But can you please reach out to the schools and or school board or school buses to please let them know it's okay to close the windows if it's raining or cold outside? Thank you.
Is that your last slide?
I think so. Oh,
Yep.
Here's how you register. So again, if for anyone who goes on the website, when they click on there for an appointment, they can scroll down, find the vaccine they want. We are providing first vaccines, second vaccines, and boosters. We have our van out at Rollins today. We had at least 100 people already sign up, most for boosters. The van will be at the county fair tomorrow and Saturday. And we will be at Mount Olive Church on Saturday also. And off the top of my head, I don't remember where we're going to be on Thursday and Friday. Anyway, the van's out to hopefully, if people can't get to us or they can't get to their doctor or pharmacy, we can meet them where they are.
As always, if people have interest in getting the vaccination, they should go to the county website and find out.
Absolutely.
Words
And
available.
again, the majority of primary care physicians are vaccinating. And I will just quickly remind people that we are now in flu season. And part of the discussion to make boosters available at this point is that we know there will be some people who will come in for a COVID booster who may not necessarily go their way for a flu shot, and vice versa. Somebody who will get a flu shot and then they can get their COVID booster at the same time. The FDA has said, and the CDC has said, that you can co-administer flu and COVID. We'll likely have a dual vaccine probably by next flu season. But if somebody wants to get them both on the same day, that is safe to do.
If we didn't have any flu last year, we shouldn't have any this year.
I wish that would be the way it was work. And I will throw
I
out
heard
there,
this kept away the flu. So.
it did, but we had schools closed, and we know that schools are a prime driver of flu, and most people were not at their work site. And I will just point out that very few people were exposed to the flu last year, and for people who did not get a flu vaccine, that means it's at least 2 years since their immune system has seen the flu. Their circulating antibody levels will be next to 0. So for people who have in the past not gotten a flu vaccine, this is a particular year where you want to do that because your immune system is starting from nothing.
All right.
Doctor, I do have one last thing. If the county attorney can hand you a list of questions there, if you can stop and pick those up. These questions were sent over to you 2 or 3 weeks ago through county admin. You acknowledged receipt of them. We were hoping to have the answers back. Could you please see if you can find this data?
So I
and
answered all,
send it over to us. I'd appreciate it.
And I
And
answered
in addition
all
to that, what
the
I'd like,
questions
if
that
at
I
all
put
possible,
during the
could you
presentation
please
today.
look at the possibility of seeing what you could do about a test to stay policy? You're working on that with the county schools. That'd be great if that would be something you'd be willing to work on.
So, Commissioner President, if you'd be so kind as to give me just another minute or two to talk about test to stay. So I know there's been a lot of talk about test to stay. I have been in contact with people at MDH, and at the moment there is 0 data anywhere in the country on test to stay. There is talk within the state, and I'm part of those discussions about pilot programs. So at the moment, that is a work in progress, but I just want everyone to be aware that there is no data at this point from anywhere in the country that shows that test to stay is a successful type of program. If I feel that based on the information that we're seeing, it would be worthwhile for the students and parents of Calvert County, and that's something that we will strongly look at. And again, I am part of the discussions that are happening. We're the only small county in the state that is part of those discussions.
It's amazing.
Thank you, sir.
In what regard, may I ask?
So I just had to have a negative test to fly on a plane where I'm sitting closer than I am to these 5 gentlemen up here, but a student can't test to stay in school. No response, please. We've spent an hour and
Have a
a
good
half.
day, sir.
Have a good day.